It is just such an honor that you all would trust us with this time. My goal for the Sacramento Health and History Tour and bringing the health system leaders there is just to get them off the health campus. There's so much that we can learn from community and actually from seeing the community, not just driving to a place, but to kind of take it all in, miles and miles at a time.
Accountability.
We drove through Oak Park, which is a historic neighborhood in Sacramento.
I don't think I really fully appreciated that history at all until we started to ride around the communities and see these false dividing lines, lines that divide not only properties, but us.
These are the systems in a neighborhood: education, health, housing, employment.
One of the folks who came with us was Jesus Hernandez, a PhD in urban sociology. His unit of measurement, consideration, intervention is really the neighborhood. You can actually map the geography of health disparities in Sacramento by the neighborhoods, not so much by the zip codes.
We saw a gate that was locked, still locked to my chagrin, between neighborhoods. And one side, people had been allowed to own houses, and the other side, people who were of a certain race were not allowed to own houses.
So can you believe that? That's where people lived like.
The van trip began to show me just how diverse the city is, how communities were split by freeways, and how road infrastructure and how the need for mass transit has impacted the city.
We all have incredible common ground. We want our families to be safe and secure. We want access to the support services that every city should provide: police, fire, healthcare. Taking a moment to slow down and just see that maybe we're not getting all the people, all the help that they need is important.
How long have you had the store?
Well, we opened in 2003.
I wanted to point out to our health system leadership how these are strong community entities that we depend on, not just to provide healthcare services, but to bring us young people who will then accomplish our mission of providing the best, most culturally humble, culturally competent care to the region.
As a tourist, as a voyeur, you're sort of apart from a community. You don't have a relationship other than one of being an outsider looking in.
If you look at your map, here's the Med Center. We've come down Broadway.
By going out, by initiating relationships with people in the community, you get a sense of being part of the community, about having real conversations, honest conversations.
We are the oldest and largest school in the district. We're about 8.
It was just so wonderful to see the attention of these health system leaders, really soaking up the expertise.
That is key to understanding how we got to this place and then beginning to engage to how to move beyond.
Mainly because we focus a lot on hospital care, which is very important. But the real world, the future, is going to be how we work with our communities, how we partner with communities, and understanding their needs and wants and how we can help them improve.
It's when you understand their experience that you can then be relevant for whatever the next steps are in your relationship.
This is real, and there's real beauty here, and there's real potential here, and to have that learning and problem solving go both ways, it's been life-changing and transformational.